2025. We are really happy to have each one of you here, and all of you in Zoom too. Welcome you too. So what we are going to do today is I'm going to give a very brief overview from our office perspective. This will be about 15-20 minutes. And then we're going to have each one of our department chairs give a brief overview of their departments and what happened over the last year or so in their departments. For some of you who are new to the state of the school activities, we alternate each year. We do either department chairs or associate deans and assistant deans. So this is the year of the department chairs updates. Next year, we're going to have our associate deans and assistant deans presenting to you their updates. So for my update, I'm going to be focusing on talking a little bit about our strategic vision and a progress report, a brief review of our school finances, a couple of words about next steps of what's coming up, and then wrap it up with a little bit of conversation about the 150th anniversary of the school. So when I apply for this job, I propose three areas of focus, and these three areas remain the same. So the three areas that I had proposed to focus for these 5 years was excellence in clinical education, particularly in the predoctoral programs, focus on multidisciplinary research, collaborative research, and also focus on the school's environment in terms of belonging, particularly with staff and students as well as with faculty. So I wanna give an update to you on where we are in each one of these three areas of initiatives that I had when I started this job. So these first slides are going to be kind of structured the same way as this one here. So the challenge, the vision that we had to address the challenge, what I proposed as strategy back in 2023, and where we are in terms of status now in October 2025. In green, we have things that are already accomplished or very near accomplishment. In orange or yellow, we have things that are still work in progress. So one of the first concerns that I had when I started was really a patient pool, access to patients for the predoctoral clinics. And so we propose a number of steps to try not only to increase our patient pool, but also retain the patients that we have already attracted here to the school. So the strategy was then to try to eliminate bottlenecks for patients to come to the school, provide emergency care in pace, which was not being provided at that time. So attract more patients to the school and then retain these patients. So we work for the first couple of years quite a bit in terms of pace. And so now under the leadership of Suman Vij, Dr. Vij, there have been a number of improvements in the process of admission of our patients, as well as now we are again providing care for patients that walk in pain. In work together with Ray Aldrich and his team, we've been doing quite a bit of a marketing campaign. You may have seen, if you went to a basketball game from Michigan, you may have seen an ad, the Smile Cam, also in the basketball games. Now more recently in MLife and in the Record, we have both advertisements for school-wide patients, as well as more focus in pediatric dentistry and restorative dentistry, which are clinics that we can certainly have more patients, attract more patients to the school. And in terms of patient retention, we've been working quite a bit with the schedulers initiative. So D3s and D4s now are working with our schedulers in the clinics. We have 8 schedulers now working with us. And the intent here is not only to have a more structured process to communicate with our patients, but as well as ensure that we retain these patients over time, particularly in times of transition from one student to the other. So then the next, let me see if I can take this off. The next area of focus is the quality of the clinical experiences. So to address this issue of quality of clinical experiences, the vision was really to try to increase consistency across different instructors, align preclinic and clinic, and raise expectations from both students and faculty. So again, over these last couple of years, we worked quite a bit with 519 and 520 to align the same instruments that we use in preclinic with what we do in the clinic. We hope that when these D1s and D2s move to the clinic, they are going to be more familiarized with the instruments because they have already used in preclinic. In terms of digital dentistry, we've done quite a bit. We just, a couple of weeks ago, we inaugurated the digital center. So that's already done. What's in progress now is to really integrate the digital center into the curriculum of the predoctoral program. So we want to see much more integration of the digital content into the predoc program. So lots of people to thank: Cassandra, Gisele, Mark Snyder, Dennis Fassbinder, and then of course Gary Mora and Trent Dobbs. All of this team really working very closely together to make this happen. And Mike Folk, of course, in terms of construction of the digital center. So raising the bar of expectations. So we are working together with faculty and students into developing a clinical teaching model and in faculty calibration. There is a lot of that happening in each one of the departments in terms of enhancing calibration of our faculty. When it comes to research, the focus was try to foster more collaborative projects. We have always done very well in individual PIR1s and individual grants. We feel that's important to have also a larger portfolio of collaborative grants. And so fostering vertical and collaborative research was an important focus for us. We are very happy to see the grant from Alex da Silva, the TMD grant, being recently funded. This is a very large, very beautiful collaborative grant involving several of our investigators here, as well as Harvard and Massachusetts General Hospital investigators too. There's, of course, a lot more work to do in this area too. Foster research interactions, we recently announced the Research Innovation Challenge, which is an intramural program to foster collaborative work involving at least two investigators from different departments. Joint appointments and collaborations with other units. We've been working on this. I think that there is a lot of benefit from having joint appointments as we recruit new faculty. We just had one recruited together with BMSP and biomedical engineering. And we continue to work on faculty recruitment, even in these challenging times now. We just had a faculty recruited in BMSP for a tenure track faculty and another one in POM. And we continue to work on faculty recruitment for research tracks too. Finally, in terms of belonging, in terms of environment, Lots happening here. The goal was to recruit, train, empower, and recognize our staff. The strategy that was proposed in October of 2023 involved a number of steps. This is where we are now. One of the steps was market adjustment, staff salaries. This was accomplished last year. In February, we also developed the ways we work, and that was announced in December of last year. So lots of work with Karen from Human Resources and Kathy Newton from the Chief of Staff perspective on making this major initiatives come through fruition. And then we've had a number of events over this last year, the staff listening sessions, office hours. We put this couple of beautiful murals, which we are very proud of, and it's so great to see so many of you featured in our murals. And we are working now on the staff lounge. And in terms of support for career path, there is a joint effort here to really work with the supervisors to look at opportunities for career development for our staff. So this is very briefly an update on our initiatives that relate to our 3 strategic goals that I had when we started this journey a couple of years ago. So now let's switch gears and talk a little bit about finances. This is a kind of a complicated slide with lots of arrows. I'm going to try to walk you through this slide. Some of you may have already seen different versions of this slide, but this essentially is the funding model for the dental school. Actually, is the funding model for pretty much every school here on campus. And it's based on this concept of activity-based allocation. In other words, the more we produce, the more taxes we pay. And so that's kind of the model that is used here throughout the whole university. So let's start here with the provost. The provost makes allocations for general fund, tuition fees, indirect costs, and one-time commitments. So these monies come from the provost office to the dental school. These monies total about $70 million, as you have there. Now, the school has to pay back part of this money in form of taxes, 21.4%, and financial aid and finances. So the provost gives us $70 million, it gets back $23 million out of those 70. So the net income for the dental school is $46 million. So this is the net income coming from the provost office. But then we also have income from gifts, clinic cash revenues, and sponsor research. So all of those monies come here to the dental school centrally. And now the school divides and shares these monies with operating units. About $10 million goes to several of our operating units as development office, human resources, finances, dean's office, continuing education receive this allocation of about $10 million. About $24 million goes to each one of the 5 departments. The 5 departments of the school, BMSP, CRSE, OMS, OPD, and POM. And we also allocate monies to academic affairs, CBCE, informatics, patient services, and student aid. The departments pay back a part of the taxes to the school based on the allocation of these monies to the departments. So this essentially is how monies flow from the provost office to the school centrally, and then how this the school manages monies that are allocated to school by sharing these monies with different units throughout the school, throughout the year. So we'll break this down now in sources and uses. So you have here bar graphs from FY19 to 25, so these are 7 years. And you can see here that in general funds, we've seen a steady increase in allocation of monies to the school. In terms of indirect cost recovery, it's been pretty flat. Clinical revenue has increased over these years, particularly after COVID. So lots of work put into generating these incomes here from the clinical side. Sponsored research kind of goes up and down as fundings go. So sometimes if we get a large grant, we have quite a nice increase in funds, but in general is pretty flat between, let's say, $16 and $19 million. Gifts and endowment have gone up quite nicely over the years, and other activities and transfers, it's kind of up and down too. A lot of other activities and transfers are monies for one-time initiatives. So for example, when the provost office funds our initiatives here in the school, we have these monies listed under other activities and transfers here. So in terms of uses, here is the breakdown of our uses. A lot of it goes into salaries. So here you have faculty salaries and then staff salaries. You see that for staff salaries, there was quite a nice increase over these last 3 or 4 years. Of course, the higher numbers for salaries, also fringe benefits, also go up accordingly. Financial aid has been pretty flat, perhaps these last couple of years, a little bit more distribution than in previous years. And then supplies, we have seen again a decrease during COVID times, and then more recently an increase again. And this increase is primarily due to, of course, use in the clinics. Now all the clinics are operating again, and inflation, increasing costs of the supplies. Transfers to construction, 19, we still had quite a bit of monies going into construction. This really leveled down quite a bit. The $1 million that we have here was for the construction of the digital center. But these are monies that are dedicated for construction. These are numbers of staff and faculty since 2018. So you'll see that the general trend was kind of a decrease during COVID and now a recovery in numbers of both faculty and staff. In terms of faculty numbers, these are faculty of FTEs. We are essentially back to where we were pre-COVID. In terms of staff, we are trending up, not quite all the way back to where pre-COVID numbers were, but we are trending up slightly in terms of numbers of staff too. So these are numbers of, again, numbers of faculty and staff FTEs. What's coming up for the next couple of years? We are getting very, very close to have a contract with PDS Health to provide EPIC here for the school. We hope to have this contract completed within the next few weeks. There are still some areas of conversation between lawyers, but that's kind of where we are now with EPIC. EPIC, of course, is an electronic health record. The goal at this point is to make the transition from Axiom to EPIC at some point towards the end of next year, middle to end of next year. So this is 2026. For 2027, we are really looking at the renovation of the simulation lab, the Sim Lab. Sim Lab is about 26, 27 years old now, the equipment that we have there. We are having a little bit of trouble finding replacement parts for the Sim Lab, so it's getting to a point now that we really need to renovate it. And so that's the plan for the spring, summer of 2027, if everything goes well. And development office and many of us here are very focused and engaged on developing funds, generating funds for renovation of the research tower. So this is part of the building that was not renovated during Blue Renew that we absolutely need to renovate. So this is, it's in a future that I cannot give you an year here because we don't have a commitment yet for these funds, but we are working very hard at generating funds for this renovation. Very good. To wrap it up, 150th anniversary this year, lots going on. Super proud of this, of how the school really is coming together to celebrate the 150 years of the school. We started in January with a week of appreciation. We thought that it was super important to start by recognizing the most important folks in all of this, the history of the school, which is our students and staff and faculty. So we didn't want to do to kick off the year looking outward. We wanted to celebrate all of us and what each one of us brings to the school. And this was the last week of January that we had this week of celebration. Then at the 150th day of the year, with an 150-inch cake, we celebrated the 150th anniversary back in May. It was a very nice event with very nice participation of the school in a great-looking cake. This was the research symposium in June, so we wanted to have a moment to celebrate the research that is done here in the school, and we brought together a great number of speakers and students and faculty and staff engaged in research in June for this celebration. In September, we had a tailgate, so big thanks to Tom Anderson for allowing us to use his tailgate facilities, the Wolverine One bus very close to the stadium in front of Chrysler Center. And here I really want to give a big thanks to Carrie Towns and all the HR office for tremendous work that they've done over this entire year to support our activities for celebration of the 150th anniversary. And Tom Anderson is here with his wife. So last couple of weeks ago, we opened the Digital Dentistry Center. That was a very nice event and very meaningful to many of us. I personally wanted to do this for about 10 years. And so I'm so happy that now the center has become a reality. And of course, big thanks to Gary and Trent that are working on the center, and Cassandra, Dennis, and Gisele, and all of you who helped us to make this a reality. So to wrap it up here, I really want to say that the most important of all that we do is the community that we have, is the people that we have. And if we today are considered a top dental school in the world, is because of the people that we have. And so I'm very, very proud to work with each one of you. And I really want to say that it's because of you that we are where we are today. So now I'm going to stop here. We're going to have the chairs presenting about their departments, and then we're going to open up for questions and answers. Okay, thank you. So now next is going to be Dr. Jen Hu. She's going to talk about the BMSP department.
Yeah. Thank you, Jack.
Thank you. So you want to...
I'm okay. I'll shout. Thanks. Good afternoon, everybody. Thank you for being here. I am very proud to present the updates on our department, BMSP. It has 158 members. These are core members of our department as well as our school. We are a strong supporter of the school's mission as well as core values. In 2025, despite the fact that we have 13 out of 40 faculty FTE positions being vacant, our faculty stepped up to cover all the responsibilities as well as continue to support the school's academic programs. Coming into fall term, we are pleased to have recruited Dr. Jae-Won Jin as tenured associate professor and Drs. Eugene Chan, Soumya Kapoor, and Nathan Cho as clinical instructor in prosthetics, and Dr. Stephen Ridley as our adjunct faculty. We are very pleased that our current search for clinical assistant professor in prosthetics is going well with a large pool of excellent candidates. We're hopeful to fill 4 approved positions. And at this time, I'd like to thank the support and guidance from Faculty Affairs along the process of these critical faculty search. In 2024, our graduate program successfully completed the CODA accreditation without reporting a requirement. And that was a great thanks to the guidance and support of our dean, Carlos Gonzalez from Academic Affairs, Steve Stefanik, and Diane Hosier for guiding us through the entire process. And our graduate faculty, clinic staff, resident, and Fei Liu, as well as Berna Zaklik, put in significant hard work to complete this process. In terms of our research, despite the uncertainty of funding levels at the federal of funding situation at the federal level, our faculty put in extra hard work and demonstrated 30% increase in terms of research proposal submission in 2025. And if we can use total research expenditure as an indicator of research activities, in 2025, the total expenditure surpassed $9.5 million. And that was small decrease compared to 2024. However, 2026 first quarter, the expenditure has exceeded $4.1 million. We're well on track to have a wonderful year of research performance. In the area of patient care, our prosthodontic clinic, which include the faculty practice and the graduate clinic activities, saw an average of 9% patient visit increase and a remarkable 270% of increase in net operating income. And that was tremendous accomplishment thanks to our clinic staff, faculty, residents who are providing excellent patient care. And we are very proud of our group. And special recognition to our residents who are not only delivering excellent cares to our patients, they are also representing the program as well as our school at national level, specifically in research competitions and specialty board examinations. In terms of sustainability, for many years, our department has been operating in a deficit. And in 2023, with the school's support, we were able to engage and begin in a deficit reduction plan. And over the last 3 years, we have been successful in reducing 1/3 of the deficit, which totaled $800,000. We are on track to make even greater reduction, and thanks to school's support and understanding, as well as our department administrator, Mike Ferguson, in the audience, who has significantly improved our financial operation, ensured transparency, accuracy, and also established a projection allowing us to better utilize our fund and be able to meet our goal of eliminating the operating fund deficit in the coming years. So with that, I want to talk about going forward. We're going to focus on actively recruiting faculty to restore our teaching capacity and also expand our research programs. And we are assessing our clinic staffing and improving our workflow management and preparing our clinic to transition to EPIC program. We continue to provide seed funding to foster research collaborations for our faculty, and then increase the scholarship fund for graduate students is direly needed. At this time, it's extremely limited, but we will put effort in this area in the coming year. And as always, we will promote excellence and recognize outstanding performance for the entire department. So with that, I want to thank you for your attention, and I want to introduce the Department Chair of CRSE, Cardiology, Restorative Science, and Endodontic, Dr. Fontana. Thank you.
Okay, good afternoon, everyone. Good afternoon, everyone. Thank you. Hello. It is a pleasure to be here with you to tell you about our wonderful department, and I will speak fast. Part of it is my Hispanic gene, I can't help it, so I apologize. So let me tell you something about our fantastic faculty. We have 34 full-time faculty with 3 positions currently open and approximately 97 adjunct faculty. The number varies depending on the time of the year, but it's approximately 15.6 FTE across our disciplines. Many of our faculty have very important administrative functions in the school, and we thank them for all the wonderful leadership and work that they do. There has been a year of changes for us. We have welcomed many new adjunct faculty. You see some numbers there just since January of this year, some full-time faculty member. Some adjuncts have returned, and we always are so delighted to have them back. We have had retirements, departures, leaves. These things always create a little bit of challenges, but also offer fantastic opportunities. And you will hear some of those things that we've done. You have a new chair, you have a new associate chair, you have a new discipline coordinator for restorative, a new discipline coordinator for cardiology. I want to thank everyone who stepped in to these roles on top of their busy schedules, and for those who did these roles beforehand, because they really contribute to the service of the school. I should put 134 pictures here to represent all of our faculty, because they have done a wonderful job this past year, working very hard in their own disciplines to foster the research, education, and service missions of the school. So thank you to everyone. We, of course, have wonderful staff, and you see a picture here from our staff retreat this year, right? 41 full-time staff who staff our clinics, our research, and our administrative units, and many part-time staff members. Many of them have been with us decades and decades, which shows a commitment to the department and the school, and we thank all of them for everything that you do. We've had a lot of restructuring within the office of the school with new people coming in. One new full-time staff member in the office today. Go and say hi, please. And people stepping in temporarily to help us. And I want to thank everyone who stepped in to help keep the department going. We've started this year with several things to build community. And I think these efforts are starting to really pay off. I want to tell you about accomplishments, but rather than telling you about endodontics and restorative and cardiology separate, I picked topics that really encompass all 3 of our disciplines. So let's start with education and clinical excellence, because those are pivotal to our school. We deliver evidence-based content across our disciplines and courses. I don't know if you know, but we direct or co-direct 79 of the 169 courses of our DDS curriculum. That's about 60% of the credits needed to become a dentist. So that's a huge research responsibility. We've had this year, because of all the changes, numerous courses being reassigned and redesigned with enhancements. You see a few examples here at the course level, at the assessment level, and at the instrument techniques, et cetera, that are applied in clinic, which we're very excited about. We've had enhanced rigorous mandatory faculty calibrations across all disciplines. And one important mention, and Dean Noor already talked about the Advanced Digital Dentistry Center, but many of our faculty lead together with others in the school this effort and are involved in teaching digital scanning, printing, simulation. You see some examples here, and we only look forward to expanding those in the curriculum as we move into the future. And we hosted this past year the very prestigious Digital Dentistry Educator Conference, where educators from all over the country came here at the school to learn together. We could maintain competitive graduates programs in endodontics, restorative dentistry, and regenerative dentistry. So as an example, this past year was one of the best years for our endodontic program, with 63 very high qualified applicants for only 4 spots. So it's fantastic. Community and professional impact. This has been a busy year. Our faculty are involved in leadership in many organizations, nationally and internationally, and you see a few of those there as editorial boards or editors, and have won prestigious awards locally here at the school, nationally and internationally. Our faculty chair, participate, or are members of many NIH study sections and NIDCR Council. We have participated very strongly in advocacy and policy outreach, and this has been a busy year for fluoride, as you can imagine. So several of our faculty participate in the state advisory fluoridation committees, FDA panels, et cetera. And of course, we're involved in CE courses, many of them national and international. The odontology course brought people from all over the world, and a wonderful example. For research, we have maintained excellence in research, 83 peer-reviewed publications, 7 book chapters, and grant submissions, totally securing funds for almost $6 million this past year. So where are we going in the future? We have many strategic initiatives for the school, but I'm going to focus very briefly in 3. We want to maintain excellence in our workforce and community because, as Dean Noor said, we are our people. So efforts to recruit, to retain, to support both faculty, staff, and community, internal and external, are pivotal to what we do. Enhance curriculum innovation. This is not what we teach, but how we teach, so that our students can have the best experiences and the best learning, both at the DDS and graduate curriculum. And then, of course, improve our teaching care and clinic initiatives, and continuing with our rigorous faculty calibration. You heard Dean Noor with some of the school-wide efforts with the new HR clinic workflows, and we're going to be very strongly supporting all of those efforts. And of course, improving our learning, patient care, and clinical outcomes. Thank you very much. And I'm going to turn it over to Dr. Sean Edwards. There you are, Sean. Thank you.
Thank you. Okay. Thank you. You are okay. Yes. Okay. Well, good afternoon, everybody. Thanks for being here. New for me, new in the role. So one of the big changes here is I am the new chair of the section, just like Margarita, I guess. And so I'm going to talk to you about oral maxillofacial surgery and hospital dentistry. And the way we keep growing, I really ought to include oral facial pain as our third tag to our moniker. So our accomplishments for the past year, we're growing, and we've launched 2 faculty searches last year, one of which is now complete. We have a new faculty member who will be joining us in February. Her name is Carrie Baldwin. She is a U of M alum, but undergrad alum, Harvard, UNC. She's currently at Wake Forest now, and will be joining us. Looking forward to that. We've added Derek Holacek, who's one of our homegrown residents, is one of our clinical instructors. And we've added Thomas D'Souza from Brazil as another one of our instructors, who's been a wonderful addition to our department. One of the other big growths that we've done in the last year is the state of Michigan, which we don't necessarily see here at the School of Dentistry, is in desperate need of trauma coverage. So for facial injuries around the state. And so we've expanded to include 15 additional hospitals across the state now that we cover facial trauma call for. So we do the entire Munson system. So think of the northern part of the Lower Peninsula. That's all oral maxillofacial surgery now at U of M. And then UMH West, which is Sparrow, another 7 hospitals on the west side of the state, where we now provide all the facial injury coverage for them. So it's quite a big meal to eat for us, but it's been good, and the state needs it, and hopefully we have the expertise for it. We've gone through quite a change in how we provide sedation in our clinic, and we've revamped some models to align with some national standards now. And so we use highly trained, specialized dental assistants now. There's educational reasons for that. There's cost structure and efficiency reasons that go with that. That was quite an undertaking. We've launched an entirely new resident education program. We've done this with Karen Carver, who is our program director. It's a capsule model. We're tying in lecturers from all over the world. So we've been getting lectures from Chile and Brazil. We'll have additional ones from European centers, Canadian centers, and centers around the US to augment the education of our students and our residents. We have always had a large profile in the national and international scene, and we almost always have faculty on all the national leadership roles, but we've made some especially big gains in the educational world in the last year. And I wanted to celebrate two of our faculty. Dr. Zupalari has been appointed to our national organization, the American Association of Oral and Maxillofacial Surgeons. He's now on the committee that sets the educational mission and agenda for the entire national meeting program. He's also on the main committee now directing undergraduate education from the oral surgery side of things at the national level. And then Karen Carver, who's our residency program director, has been appointed to our faculty section. Our faculty section is really important because not only do they drive what we teach our faculty and how we teach oral surgery, but they're also responsible for developing our educational standards at the national level, which then feeds up to CODA for accreditation standards. So incredibly important positions where the Michigan M is very well represented. We've also completely revamped from an operational side our referral system. We've gone fully online. We had, when we started this process, just to give you an idea of the scope of work, we had 33,000 referrals, new patient referrals to our department sitting in a queue. We get about 140 a day new referrals. And so we've worked with our amazing IT team, and thanks to all of them for their hard work, to code and develop a new process where we can triage patients to get them in. Because as you imagine, like all of us, the demand for Michigan's talent is huge. We have had some interesting things that have happened in the oral surgery world. And you know, training in oral surgery is longer than the other specialties. It's more expensive because medical school has become a bigger thing. And so there's been a decline in the interest of dental students to apply. We've seen the opposite trend in Michigan. I mean, I think probably because of the amazing students and faculty and staff that we have here, but also we've been able to match 100% of our students in residencies around the country. Nobody else is doing that. We have almost 60 students that showed up to oral surgery interest group. Nobody else is doing that. It's incredibly productive and efficient program. It's made our students be in demand nationally because of the quality of the students that we have and the staff that we have support them. And that will be something we continue to grow. One of our faculty I want to highlight, Dr. Brent Ward, who's our past chair, was highlighted this year with the AMOS Presidential Award. This is the biggest award our specialty gives out. They've recognized him for decades of service to the specialty. That's a huge thing for us. Lots of research happening in our department. One grant that Jacques mentioned, Dr. Noor mentioned, sorry, to highlight and that we're part of is AI for TMD research. We're part of this multi-center trial, total funding about $3 million a year. That's probably the biggest project for us to highlight. We have lots going on in OFP education, orofacial pain. We're expanding and integrating the pre-doctoral students in new ways in the department. Liz Hatfield's been our champion for this, has done an amazing job of this. It had the largest number of applicants to the residency program in their past year. That program continues to grow. And as it turns out, based on some business data that we've got, is the main referral site now for the entire state of Michigan for patients with orofacial pain. And our GPR program, which continues to expand, is now up to 7 residency a year. It was 2 residency a year when I first came here 20 years ago for residency. We have lots of goals, and then I'll finish up real quickly. So that big new hospital is built over there. We are part of one of 4 surgical services moving in there. This is a 20% increase in our operating room time, which means more access to care, more opportunities for innovation and collaboration, lots of new opportunities with that. We're going to hopefully finish up our second faculty search in very short order. One of my big targets is to improve access to orofacial pain and TMJ care, both surgical and non-surgical. We have a 2-year wait list for some aspects of surgical care. We have a 1-year wait list for non-surgical care. And then parallel to this, I'm launching a dedicated multidisciplinary cancer survivorship clinic. And so this is for patients, children and adults who've had cancer care and then who can't find somebody to take care of their dry mouth, their neck pain, their facial pain, their trismus they can't deal with. They can't find dental services to provide to take care and prevent dental decay. And so I want to find a home for that and put a label on it so that people know where to go. And that should drive education and research as well. And then finally, as recently as this past week, we're still looking for new ways to continue to integrate with and support the amazing offerings that go along with the Digital Dental Center. And now my mouth is dry and I'm done. And so Dr. Hatch, you're up next. I'll put that down. All right. Turn it off.
I only have one arm.
Oh, fair enough.
Me.
Is this working? Okay, great. Hi, everybody. I'm Dr. Nan Hatch, Chair of Orthodontics and Pediatric Dentistry. I'm happy to be with you here this afternoon, talk a little bit about what's going on in our department. It's always fun to be with all the chairs at once and hear what's going on. I can say that I approach this a little bit differently. I'm not going to do a comprehensive broad approach to updating you on what's been going on in our department. I'm doing like the flowers on the icing on the cake kind of thing, highlights. So accomplishments from this past year, I'm highlighting first what we're calling the Craniofacial X-Lab. This is something we have been working towards in the department for the last few or more years and is finally fully renovated and in function. So this is a research, learning, and teaching space on the second floor of Kellogg that has one room for 3D printing, and the other area is for XR technologies, primarily in education. I'll talk about that more on a subsequent slide, but we're really excited that that's done and active. Next, I'm going to talk about resident awards. We are fortunate to have two very prestigious graduate programs in dentistry in our department. In pediatric dentistry, we had two residents win top research awards at the 2025 American Association of Pediatric Dentistry meeting. I've listed their names here. And then in orthodontics, we had a student win a top clinical award and a student win a top research award. So at the 2025 American Association of Orthodontics meeting, again, our student won the Student of the Year competition. And this is a really competitive competition. We have tried for years helping the students, helping somebody get this. And this year we finally struck gold. So very, very exciting. And then we also had another resident present her research at the meeting and receive a research award for her research. So all the research awards are going towards, of course, master's thesis project work. So it's very exciting to see our residents excel. We try and give them the opportunities to excel, and we're very proud of them when they do. Finally, I'm going to highlight a couple continuing education courses. I'm focusing on orthodontics because the premier pediatric dentistry education course is given every other year, so it was not given last year. So I'm focusing on our 39th Jeraback lecture, which was given by our very own Dr. Chris Roberts. He's a highly dedicated adjunct faculty member in orthodontics and also very involved in organized orthodontics. And he's over time become known as an expert in business management, practice management, et cetera. So this was structured as a webinar organized by Dr. Hurricane Berman. And I believe it was our highest attended Jeraback lecture yet. So we are really moving in the right direction with our CE courses. And then, of course, I always have to highlight our Moyer Symposium because whether you realize it or not, it's a big project of 2.5 days of speakers that we organize every year around different topics. Last year, we went back to a more basic orthodontic topic, but I will give a plug for this year, the 2026 Moyer Symposium, because I've seen TMJD come up on multiple slides. So clearly this is still a problem for patients, and many of us really want more information and understanding how to better manage these patients, potentially treat these patients, or at least know who to refer. So we are going to have speakers such as Liz Hatfield from oral surgery. There you go. Thank you. So we're going to have TMJD speakers as well as orofacial pain speakers focusing on behavioral approaches, psychological approaches, and then obviously dental and orthodontic approaches. So that should be a good one. And then just a few simple goals for the coming year that I'm focusing on. I have been encouraged to let everybody know, I guess there aren't too many dental students in the room, but that we are striving and we will maintain a strong predoctoral orthodontic curriculum. There we go. Because there's been a little bit of concern apparently on the part of the dental students that because the prior director of predoctoral orthodontics, Dr. Sevedanis, has left for another institution, there was concern that there would be loss of this source of education for the dental students. That is not the case. You can report to all your classmates. That is not the case. There will be only one switch this year in the timing of a course, but we predict no major changes in the coming years. So be secure that this is going to remain strong. Next, I really want to highlight public health and pediatric dentistry. Dr. James Boynton, Director of Grad Pediatric Dentistry in our department, won a HRSA award in collaboration with public health faculty, and Dr. Gigi Medier. Anavazi. Sorry, I just lost myself. Okay, so the whole idea here is to bring pediatric dentistry faculty and courses into this building for the pediatric dentistry residents, so they can opt in to receive a certificate in public health as well as pediatric dentistry. This also provides tuition support for those students before they get to the hospital, where they are provided GME support. So this is our first year starting this, so we're really looking forward to see how this rolls out. And then finally, fundraising for students, scholarship fundraising. This is something we've been doing for a long time, but kind of at a lower level. And then at our 100th anniversary in 2023, we made this a primary fundraising goal, again, in collaboration with development. Carrie Towns is probably somewhere else working on something because I don't see her in the room. But anyway, we have made great progress. We are giving solid scholarships to a certain number of residents per class, but we haven't reached our ultimate goal, which is a scholarship for every orthodontic resident in every year of their program. It's a 3-year program. It is expensive. I'm going to finish here talking about the craniofacial X lab. This is obviously not the only kind of research we do in OPD. And the fact that I've really just done some sprinkling of highlights, I don't want you to imagine that we're just taking it easy over an OPD. I could have, anyway, we're always on top of finances and all that other stuff, but I'm just focusing on this today because this is fun. This has taken us a while to get here. This came about with no support from the school or the provost. So this is on the 2nd floor of Kellogg. You see on the lower left there's a picture of the 3D printing lab. This has state-of-the-art printers for current day use in 3D printing. And we have even more advanced 3D printers where we're doing research in materials and methodologies to really advance self or in-office 3D printing of clear aligners to move our profession away from a point where we're beholden to corporations to do clear aligner therapy for our patients. So that's very exciting, and that's been a dream of mine for a long time. So I'm not the faculty doing it, but I'm so happy that we're here. And then, of course, driven mostly by Dr. Harakim Berman, who I have to say is at home down and out with the flu, poor thing. This is the augmented and virtual reality technologies portion of the craniofacial X lab. So on the upper left, you see dental anatomy. That's already been incorporated into the dental student curriculum a few years ago. That was based on virtual reality. But mostly I want to focus on what says Arian, but it actually is augmented reality for inferior alveolar nerve block. So under that blue line on the left, you see a tray with the items on the tray that will be used in this augmented reality module. Then in the middle, you see a student sitting in front of that tray, but the student has XR goggles on. So on the right, you see what the student experience is as they're entering the augmented reality module. And the great thing about this is they get haptic feedback using actual needles on a typodont, and they also get accuracy feedback so they can practice and learn and get better at this challenging technique before they go into the clinic and start that friendship clinic. I don't know who came up with that name, but anyway. And then obviously we're working on, or we have faculty in the department working on orthodontic modules, and I wrote a black rectangle there for what is your module. If you have an area in dentistry or a specialty area in dentistry that you think virtual reality or augmented reality could help your students learn or practice, we now have the resources and a solid knowledge base to support this. And I would be remiss if I didn't put the little fetch robot over there on the right, because most recently, this is what happens when you let faculty just go and explore and innovate. They're investigating fetch robots in collaboration of pediatric dentistry and orthodontics, really as a patient management and morale. That's where they're starting effort. So who knows, in a couple years, you may see fetch robots running around OPD. So that is it from me. I want to next introduce Dr. Purnima Kumar, who's going to tell us about POM.
Thank you. When you only have 2 minutes left of a 1-hour presentation, it means you're part of a fantastic team that's doing amazing things. So I'm going to hit the absolute highlights and of what we're doing in POM. And again, this is just what happened this past year. We have 2 wonderful groups. So POM is perio-oral medicine. And under oral medicine, we have oral radiology, oral pathology, oral diagnostics, oral medicine. And the division of dental hygiene is also housed within POM. So we are a very large division, vibrant, fantastic faculty. Now we have the privilege of bringing in 2 new resident classes, one with the dental hygiene program and one with the perio program. And they joined this amazing group of folks. So every year we have an annual picnic, and that is a picture from our welcome picnic for the residents. We have a very large faculty group. We are 64 strong. And this year we've had the privilege of having 2 new faculty join our group. Dr. Eri Takamatsu is an MPACT scholar, and she joins us as part of the MPACT program, which, as Dr. Dean Noor was talking to us about, is part of our large initiative collaboration with the external university. And of course, we have Dr. Gustavo Avia Ortiz, who's coming back home. He started life here as a perio resident, traveled all around the world and decided that there's no place like Blue. So he's back home here with us. And he will be taking over from Dr. Homlei Wong as the Periodontal Graduate Program Director in January. So we're very excited to have these 2 amazing stars join us as part of our large faculty. Our faculty, of course, are doing amazing things. We just got back from the AAP meeting in Toronto where, we painted the town blue. The entire meeting was filled with folks from faculty and adjunct faculty from our departments as speakers, as award winners, as research mentors. Our residents won awards. Our fellows won awards. We were very well represented, and of course put the block M everywhere we could go. So we're very glad that these 2 folks are joining us. We've had a lot of different activities on both the CE and the research side. POM is very well known for the CE content that we provide. Historically, we've had that. I'm going to start this one, this course, this Advanced Periodontal and Implant Surgery course that attracts international folks. This year, we added a huge new CE offering that is a soft tissue grafting. It will be oversold, oversubscribed, and are already taking bookings for next year, which is 50% subscribed already. So we're doing exceptionally well in that. We also had the Dental Hygiene Symposium this past year. Again, an incredible meeting, very vibrant, lots of new course offerings, and that was very well received as well. The upcoming year was going to be the year of the Ramford and Donald Kerr Symposium. Along with that, we will also have the Osteology Research Center that will be sponsored here. So lots of exciting events to look forward to. We have always had a history of being well-funded, not just through the federal agencies, but also through foundations and industry and oral healthcare contracts. So we continue to do that. We continue to grow in our funding efforts. Our big highlight this year is Ann Decker, who got her first R01. And as an early investigator and as a new investigator, that's a very big deal. So we're very proud of her and her achievement. Next year, as we move into next year, of course, our goal is always to increase grant funding. And we're really focused on that. And thanks to Amy Story, who sits here, for her excellent stewardship of our funds and management. So we continue to do that, continue to grow. We are definitely increasing opportunities for alumni engagement. And one of the things that we really are focused on is creating a chief residency fund that is being, thanks to our faculty development, Carrie Towns and Kelly and their group, for helping us develop this program in Hamlei's name. So Dr. Wong Chief Residency will start. And it's a very specific program, which is, geared to creating leadership training among residents, because ultimately we do train leaders and best. And so this follows with our fundamental strategic principles, and we're going to continue doing that. So I think it's clinic time or question and answer time.
Well, thank you. Thank you to the chairs. Thank you all for being here. We are not going to have time for questions and answers. If you have questions to us, come to the Dean's open office hours, and we're going to try to address them. Thank you all for coming. Thanks.